This time I'm going to discuss the anatomy of the kidney in addition to blood flow through the kidney. So we'll talk about the anatomy of the blood vessels in the kidney. All right, so the kidney is composed of an outer capsule that's like a protective outer coating of the kidney. But if you look inside the kidney, you'll see two major layers. Near the surface, you'll see what's called the renal cortex. Cort meaning near the surface. For example, near the surface of your brain is the cerebral cortex. So same meaning here for the word cort, near the surface. I'd like you to think of the renal cortex as the functional area of the kidneys. It's the part where urine is being created. So up there in the renal cortex, you've got lots of little blood vessels leading to lots of little filters that filter metabolic wastes out of your blood. So that's where urine production happens, is primarily up in the cortex. And then in the center, more central area of the kidney, you've got the renal medulla. And you'll notice it's organized in pyramids or triangular shaped structures. In the case of this medulla, it looks like we've got about 6 pyramids depicted here in this artist illustration. So each triangular unit is a pyramid. Urine will trickle down through those pyramids in the medulla. And then that urine will be captured in little areas called a calyx. A small calyx is called a minor calyx. And then the calyces, the minor calyces, will merge to form what are called a major calyx. And you'll notice on this kidney we've got 2 major calyces. And then the major calyces will merge to form an area called the renal pelvis. And the renal pelvis leads out of the kidney to the tube called the ureter. And as you've learned in lab, the ureter leads down to the urinary bladder, where the urine will be stored for a while. And then after storage, the urinary bladder will squeeze and you'll release urine out the urethra. So let's do that whole path again for urine formation and the flow of urine. You create urine up in the renal cortex. Then it'll trickle down through the renal medulla, which is the layer that includes the renal pyramids. So the urine will trickle down a renal pyramid, and then it'll lead to a minor calyx, which will merge with other minor calyces to form a major calyx, which will merge to form the renal pelvis. There's only one renal pelvis in each kidney. And then the renal pelvis leads to the ureter, which leads to the urinary bladder, which leads to the urethra. If you haven't figured it out already, tracing problems are a good way to learn the urinary system. Okay, here's a close-up view of one little slice of a kidney. Up at the top, we see the surface of the kidney is the renal capsule. Deep to the capsule is the area close to the surface called the renal cortex. That's where you've got your filters for making urine. A urine producer or urine filter is called a nephron, and you'll see several nephrons depicted there. Looks like 4 in this diagram. So that's where you're going to make urine, is up in the renal cortex. And then down, the urine will travel through the renal medulla in a pyramid. Remember, the medulla is made up of many pyramids. In this illustration, we're just seeing one pyramid. And the urine will trickle down what are called collecting ducts, which are located in the pyramids. And then each pyramid, at the base of each pyramid, it leads to a little cavity called a minor calyx. Now, instead of thinking of the flow of urine, let's think about the flow of blood into and out of the kidney. So I'm going to introduce a bunch of vessel names. You've already learned in lab, back when you were doing the blood vessels in your first lab unit, you already learned that the renal artery feeds blood to the kidneys. And of course, the renal artery branches off the abdominal aorta. But where does the blood go from there? Well, each renal artery branches into multiple arteries called segmental arteries because, separate segments of the original artery. And then the segmental arteries will branch and form what are called interlobar arteries. Inter means between, or between lobes. We're going to be going between the pyramids of the medulla in areas called renal columns. So think of columns between pyramids. That's where the interlobar arteries will be. And then we're going to arch over a pyramid in an arcuate artery, arc meaning arch shape. And then we're going to go up into the cortex, in between particular areas of the cortex. So we're going to use the word for between again, inter. But instead of interlobar this time, it's interlobular. Lobule just means a section of the cortex. So we're going to go up into the cortex by way of interlobular arteries. And then finally, we'll actually get into a urine producer, a filter, and we'll get there by way of an afferent arteriole. Arteriole means teeny tiny artery. Afferent means to feed into. So it's an arteriole that leads into our urine filterer. The whole name of the urine producer is called a nephron, but the part that blood goes into is called the glomerulus. And that's where actual filtration takes place, where wastes will be filtered out of the blood. So let's look at what those arteries look like on a diagram. So let's follow that path again. All right. So go ahead and find the renal artery on this diagram. I just put a number 1 on it. So that's where we're going to enter the kidney, is by way of the renal artery. Note that the renal artery branches. Those branches are called segmental arteries. Each segmental artery will then further branch, and those branches will go up between pyramids. So we're going to use the word between, and that's interlobar. So look at where I just put a number 3. Interlobar arteries go between the pyramids of the medulla, and the gaps or spaces between the pyramids are called columns. So the renal columns are where you would find interlobar arteries. And then we're going to make our way up through that column, and then we're going to be finished with the medulla, and we're going to be up closer to the cortex, and we're going to go over a pyramid in an arch-shaped artery called an arcuate artery. That's where I just put a number 4. Now we can actually enter the cortex, and we'll go up into the cortex between areas called lobules. So we're going to be in an interlobular artery where I put number 5. Now look over at the right-hand diagram. That is a close-up of the area that I just numbered 5. So in the diagram to the right, we're looking at a close-up of the cortex. All right, so find the interlobular artery on that diagram, and note that I just put a 6 on the branch that comes off of it, called an afferent arteriole. And that afferent arteriole will lead us to where we will finally get to actually filter the blood to make urine, number 7 there, which is the glomerulus. And the glomerulus, if we're filtering blood, the glomerulus has to be capillaries. Because remember, capillaries are the only site of exchange within any blood vessels. Arteries and veins don't do exchange because they're not porous. They don't have holes in their walls. So the glomerulus is a set of capillaries at which we do filtration. All right, let's go through those steps one more time. So look back at number 1. That would be where we enter the kidney. That's a renal artery. From the renal artery, we will branch to find segmental arteries. Segmental arteries enter the kidney and go up into the columns. And at this point, we would be talking number 3, which is interlobar arteries, between the lobes. We're between the pyramids, in other words. And then find number 4, we're going to go over a pyramid in an arc-shaped artery called an arcuate artery. That would be number 4. And then number 5, we're finally going to get up into the cortex. That would be an interlobular artery. Over to the right, we can see the interlobular artery again, and coming off of it, number 6 is an afferent arteriole. Afferent means we're going to enter something, and what we're going to enter is the filtration part of the nephron called the glomerulus. That would be number 7, and the glomerulus is a set of capillaries. Now, in the glomerulus, we will filter that blood in order to make urine. And then the blood needs to get back out of the kidney. So let's follow the path of blood back out of the kidney. So we'll be in the glomerulus where we will filter the blood to make urine. And then we're going to exit the glomerulus by way of an efferent arteriole. EFF means to exit. So we will exit by way of the efferent arteriole. And then the efferent arteriole is going to lead to what are called peritubular capillaries. These are a set of blood vessels that surround the tubes of a nephron. Peritubular means around the tubes. We'll talk a lot more about peritubular capillaries later on in this set of lectures. For now, know that it's the site of reabsorption. By reabsorption, I mean putting good stuff back into the blood. So if we filtered out anything we shouldn't have, like say some important sugar or some kind of ions, we're going to put it back into the blood at the peritubular capillaries. All right, peritubular capillaries merge to form interlobular veins. These words sound familiar now because the names are going to mirror the names of the arteries. Interlobular veins merge to form arch-shaped veins called arcuate veins, which would be arcs over the pyramids. Then we'll go down between pyramids in interlobar veins. And finally, the interlobar veins will merge to form the renal vein. Notice I never said a segmental vein. It's kind of an area of controversy amongst anatomists, but vasculature varies from person to person, and that's especially the case with veins. And some people may have segmental veins, others don't, so I'm excluding them from this list since it's often stated that they don't exist. All right, so anyways, we will ultimately exit the kidney by way of the renal vein, which, as you know, leads to the inferior vena cava. So let's follow the path of the venous tissue through the kidneys. So look over at the right. We're going to start in the glomerulus. That's where we filter the blood to make urine. From the glomerulus, we will exit by way of the efferent arteriole. So number 2, efferent arteriole. And then notice that the efferent arteriole branches to form a bunch of capillaries that surround the tube part of the nephron, and those capillaries literally mean around the tube. They're called perioles merge to form interlobular veins. So now we're at number 4 on the large kidney diagram. So look over to the left and find number 4. That's what peritubular capillaries will merge to form as interlobular veins, which merge to form arch-shaped veins over the pyramids called arcuate veins, number 5. And then the arcuate veins lead down to between the pyramids. At this point, we're going to call them interlobar veins. And then ultimately, all of the interlobar veins will merge to form the renal vein. And we will exit the kidney and head to the inferior vena cava, and ultimately back to the heart.